everyone, and welcome to Rural Roots, A Road Less Traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you're here. Gavin, Scarlett Moberly joins us today. Welcome to Rural Roots, Scarlett.
Thank you. Thanks for having me. What an honor.
Oh, I'm glad that it is. I'd like to start out with your road less traveled. And I know that you've worked across the arts, entrepreneurship, conservation, and now you're in healthcare. When you look at your path, tell us a little bit how you did these things and if there's a common thread that kind of led you here.
Yeah, I like to joke that I'm trying out every nonprofit industry, but it's been a winding road. I grew up in the North Country in Littleton, and I think like a lot of people who grew up here or in small towns in general, I couldn't wait to leave. And I did as soon as I graduated college, and then I moved a lot over the next 10 years. I didn't live in one place for more than a year. Tried on a lot of different places, a lot of different things. But I went to school for art history and eco-gastronomy, which is kind of a fun way of saying sustainable food systems. So art and food were really my two interests. And after I graduated from college, I worked in fine dining for a few years, and then I went back to grad school for art and museum studies. And then after I graduated from grad school, I moved back to New England to work. I worked at an art magazine in Boston. And at that point, I had been gone from the North Country for about 10 years. And I really had to be honest with myself that I wanted to move back. I was in my late 20s at that point. I started to think about what I wanted my life to look like. Once I had children, where I wanted to raise them. And all signs kept pointing to the North Country. And it was really interesting because it was such an easy choice, but it really did kind of take an honest moment with myself to realize, like, I was going to be circular and end up where I wanted to leave so much. Sure. But I'm so happy that I made that choice. And it was really easy because every time I came back to visit my family, I was just more and more impressed with kind of the renaissance that the area was going through. And there's just like real spirit of reinvigoration and reinvention, a lot of creative problem solving, which I really appreciated. And so I made the jump and I moved back in 2019. I bartended for a little while, and then the pandemic hit. My intention in moving back was to open an art gallery of my own and to represent local artists and give them kind of a venue to show their work and also sell it. And that was kind of put on hold a little bit by the pandemic, but I did open that gallery in 2021. And I did that for a year. It was really fun and really rewarding. And then I saw an opportunity to work at an arts organization in Bethlehem. Some of our listeners might be familiar with Ren in Bethlehem. And excuse me, that was appealing because it was salaried and I wouldn't be hustling to not only, promote artists on my own, but there would be kind of like a system to do that. So I started at Ren as the marketing and community engagement coordinator, I believe was my title, in the summer of 21. So I was doing both the gallery and working at Ren for a while, which was really fun, but also I was working 7 days a week, so that was kind of exhausting. And I was about to have my son, so it was a really busy period of my life. I closed my gallery after a year of having it open, so I could focus both on growing my family, but also on my work with Ren, which I found really engaging. I was running the gallery there, running the store, running the grants programs, doing a lot of marketing, managing the vendors and the members.
A real Renaissance woman.
Yeah, if you've ever worked in a small nonprofit, you know that you have to do a little bit of everything or a lot of everything. Yeah. And when I started, it was just a team of two, as the executive director and me. And Ren was really in a period of transition, which was exciting that we could kind of reinvent Ren itself. After a couple of years there, I came across an opportunity for the program director at the Rocks in Bethlehem. And if any of you are familiar with the Rocks, it's owned by the Forest Society, which is a nonprofit conservation organization. And it too was going through a period of transition. It had been closed for several years and had built a beautiful new facility, and now they were looking for someone to run that. And so I did that, and I knew nothing about conservation organizations, but I knew a lot about program development at that time, and kind of community engagement, and again, wearing a lot of those hats. So I jumped into that, and that was very fun, very interesting, very busy, very engaging. Again, doing a little bit of everything. And then the position I'm in now came up, and again, it was a moment of, well, here's the opportunity and you've got to take it, so you might as well jump. And I did. I knew nothing about healthcare. I never worked in healthcare, never really thought about working in healthcare. But I knew that a lot of my skills that I had acquired over the last few years, both in my education and working for nonprofits, were really transferable. Working in grants, working with the community, developing programs, that sort of thing. So here I am.
Here you are.
Well, and I can just say right away, I kind of also I can relate to the healthcare jump. I was one who jumped into healthcare right as COVID had hit, so it certainly was an enlightening period for me to kind of be thrust into that world because it is so different. So I'd love to hear from you on your perspective of kind of what grants and community benefits are in terms of the healthcare world and how they may differ, in other industries.
Yeah, so grants, I think, in general, are really just responsible for all the extra nice things that we might have in our community. I think it's fair to say that the North Country is not a very wealthy region. There's not a lot of private investment or private equity. So we really have to rely on those funding opportunities. And so many of our organizations couldn't do all the amazing things that they do without grant funding, including, NCH has a lot of programs that probably wouldn't run if they weren't grant funded. Yeah. And then community benefit is interesting. It was a concept I had no knowledge of. It's really unique to healthcare. So I kind of had to learn on the fly there, but essentially community benefit is a stipulation of the Affordable Care Act, which requires nonprofit hospitals to kind of prove why they should be a nonprofit. It's an IRS requirement, so it's really fiscally related. As nonprofits, we don't have to pay taxes, so this is to justify that, and community benefit is the concept around that. So a lot of the time that looks like providing free or discounted care to people who might not be able to pay for it, or providing care to people who are on government insurances. Those insurances don't always cover the full cost of the care. But there's also, again, kind of those extra programs that a lot of perhaps for-profit health entities would not have because they're not profitable, they're not reimbursable. But I think it's really an impetus for nonprofit hospitals to look at what the community needs to improve the health of that community and then develop programs around that. So they are related in a way. A lot of the grants support community benefit programs.
Do you want to talk a little bit about how those community benefits are, like what qualifies for community benefit, and maybe introduce our community health needs assessment and how those kind of work together for how we decide what is a community benefit, which versus this is just a nice thing we do.
Right. Yeah, I mean it's great to do nice things for the community always, but community benefit specifically has to tie into an identified health need in the community, and those health needs are identified through our community health needs assessment, which is every 3 years it's kind of a data project that we do where we assess public health data and regional health data, and then also survey the community to kind of parse out what the community is identifying as what they need. So that might pull out chronic disease as an issue, or food insecurity, or substance use disorder. So through that process, we identify kind of our top 30 or so needs, and then from that we kind of collate them into groups and identify some goals that we'll focus on over the next 3 years until the next assessment. And so the community benefit programs by law have to tie back to those needs. So it's really just an insurance process to make sure that hospitals are not just developing programs that are kind of willy-nilly. They have to relate to what the actual needs are of the community.
And can I put you on the spot for our 3 priorities for community benefit?
Yeah, our 3 goals for this community benefit cycle or community health needs assessment cycle are to improve behavioral health outcomes, improve access to care, and reduce barriers to care.
So pretty wide net.
Pretty wide net, yeah. I mean, it encompasses a lot in this cycle specifically, and you'll see other regions or hospitals that have maybe more defined needs, but it just depends on what is coming out of that data. So we don't define it; the data does.
Well, Scarlett, I think I can relate to you in the aspect of, I moved away from the North Country, but it's still, and forever will be my home. I love going back. I love the people up there. So I'm curious as to, what kind of excites you about community benefits and the coordination aspect for our system as a whole, rather than one town, one affiliate. Is there anything that excites you about the kind of systemization of coverage, really?
Yeah, I mean, I think part of what excites me about it is really personal in that, my mom's side of the family has been in the North Country. I'm 7th generation North Country, and my son is now 8th. And I think the through line in my nonprofit work up here has been really to support kind of the resilience and creative spirit that exists here. And that ties into getting this overarching view and strategic plan for our community benefits and for our grant programs throughout the North Country, because you can kind of identify where one program's doing really well and understand, well, this need is not unique to this specific town. We could, looking at it as a whole, then scale that across the system and support so many more people and really improve their lives just by understanding what someone's doing well in one place and bringing it elsewhere. So I hope that answers your question.
Yeah.
To just understand, to not only reduce duplicative efforts, but then to look at kind of tiny pockets where something's going really well and just bring it to everyone.
I want to talk a minute about what your role is and what your role is not, right? Because you've talked a little bit about your experience in program design, but I think that leads to a little bit of a misconception that you're designing the programs and that you are running the programs. What does it ideally look like when you are running a grant or looking at community benefit? What is your role within that systemic nature?
Right. So I know a lot about grants, but I don't know a lot about various healthcare issues or systems or service lines. I am not a provider. I'm not a therapist. Those are not my areas of expertise.
Some days it seems like it though.
um, so my role is really to organize and manage the grants so that the people doing the work of those grants don't have to do the administrative work of the grants. And my role is to identify funding opportunities and present them to people who they might be of benefit to, but not to come up with programs, because really I don't know how a substance use program should go. I don't know how an oncology support program should run. That's not for me to say. It's way beyond me. But when you task the people doing that work to also manage their grants, then there's a lot of push and pull there, and they have to make compromises about whether it's not seeing patients that day because they have to manage the grants, or being behind on their grant paperwork because they have to see patients. So
Yeah.
I'm really in a support role, so that we can make those programs really effective.
Yeah. Well, I think there's also the assumption or the myth that grants are free money. And what you're talking about is the amount of work that goes in behind the scenes so that the grants can get to the community that needs it, right?
Mm-hmm.
So,
Yeah, there's a lot of work behind the scenes. I wish grants were free money. There's very few funders that will just give you money without requiring anything in return as far as reporting or data, but it's worth it to do that work. But it takes a lot to put together a compelling grant application. It takes a lot of data analysis combined with kind of narrative, persuasive writing. And then once you get the money, you have to track it very closely, so you can prove that you spent it in the way that you said you were going to spend it. And then you often have to report on progress and outcomes. And if you want to go back to that funder or to try to fund that program again, you have to be able to demonstrate and to clearly communicate what went well, what didn't, what you're changing, how it's growing. So all of that, takes a lot of thought, it takes work. It's just a different skill set.
and you and I, because we get to talk about this work on a daily basis, have seen a big shift in our in the federal atmosphere of grants, and needing to be in that top 1% of quality grants. And I just want to bring that to light, because I think we want our teams across NCH to ask for the grant, that we want them to be excited about the work that they do. But when you push back with compliance conversations or metrics, or most importantly now, sustainability, what happens if that funding goes away, you're really looking at how to serve the most people for the longest amount of time, right?
Yeah, it's very challenging. The funding ecosystem has changed a lot. I got my master's degree in 2018, and I always remember my development professor. She said something that really spoke to me, and she was like, all this money exists, and by law, these organizations are required to give it out. So you just have to apply. And it's still true, but it's a little more difficult now because there's less funding available, and they're much more strict about how they're going to give it out. And so you're right, you do have to be in the top 1%, especially for federal funding in this time we're in right now. And that takes extra work. It takes, more compelling data. It takes an understanding of what you're going to do next, how this program is going to succeed after the funding goes away. So it's more than having a good idea, because sometimes even if you have a great idea and you have a compelling application and you've done everything you need to do, you still don't get funded, just simply because there's not a ton of it available at this time. So then you have to go back and say, okay, what can make it more compelling? What do we need to change? What can we cut? What do we have to put in? what is a better argument of how we're going to sustain this after the funding goes away. So you have to think about not only what you want to do now, but what you're going to do in a year or 5 years. So it takes some thinking about.
Gavin, I led us down a pretty technical path for a few minutes.
No,
there. I'll give it back to you.
I have two questions, and they're relative, but I did just want to backtrack with the first one, which you kind of hit on, but we kind of skipped over, which is, I am very curious, what, if you have a typical day, what does a typical day look like for you in this role?
I meet a lot with our team. The philanthropy and community relations department is incredible. I love meeting with my team. But we talk a lot about strategy. We talk a lot about next steps, how we can work together to support each other. I mean, we're a new department, so there's a lot of kind of troubleshooting and figuring out what we're going to look like next month, next year, in 5 years, and how we're going to support the organization. I also meet a lot with the grant teams I work with, whether we're developing an application, and I'm kind of almost interviewing people who are asking for the funding or for funding to be submitted. Is what do they need? How is that going to serve our patients? Again, those questions. What are we going to do next? And then once we have the grants, I continue to meet with them to discuss progress, milestones, trying to find invoices, things like that. I do a lot of writing. There's a lot of writing involved in grants, and then a lot of kind of very detailed tracking for both grants and community benefits.
That's wonderful. So what I'm hearing is there is no typical day.
Yeah, there's a little bit of everything every day.
Yeah, right. That's great. And then a question that Ren and I have started to ask a little more to all of our guests, and I find it so interesting because we obviously have staff that have been here quite a long time, but we also have a lot of new faces that have joined us, within a year or two, like myself and yourself. So I'm curious, what has surprised you the most about the organization or the people, that work here?
I mean, a lot has been surprising. Again, I've never worked in healthcare, so it's really been like learning a whole new language. But I think what was really surprising was that it wasn't so foreign to me. A lot of the priorities were the same as they are throughout other organizations, even unrelated organizations. At heart, it's really just an impetus to support our communities, which is something I can always get behind. And as far as what's been surprising about the people, I don't know, you kind of think of healthcare as very clinical at times, but everybody's so fun. And, everyone's been so approachable and really generous with their time and helping me to understand concepts that were really new to me. So that's been just really wonderful to feel supported, especially when sometimes we're changing how things have been done. I think people are open to it.
That's great. And outside of work, I know that you spend a lot of time gardening, cooking, skiing, and just being outside in general. How do you think having those sorts of hobbies, some of them very North Country bound, some of them you could do anywhere, right? But how do you think that influences how you think about community and well-being, either your own or the greater scope of things?
I just think everyone should have access to the opportunities that let them live well, whatever that looks like to them. I mean, access to outdoor recreation, whether that's going for a walk or skiing or whatever, is really important to our community in particular, and I think it can't be overstated how beneficial that is. And in my dream, every community has a community garden where if you don't have a yard or you don't want to dig up your yard, you can have a little allotment and grow some tomatoes. I think that that would be great. And yeah, I think living well and having the health, not only to do that, but also the ability and the opportunity and access to those is really important.
I love it. I love it. Well, Ren, I'm going to ask my famous question, if that's okay with you.
Do it. Line it up.
Which, Scarlett, if you've listened before, you probably know what's coming. But I am always curious, what keeps people coming back every day? We all have those really tough days where we sit down at the end of the day, let out a big sigh, go for a walk, stress relief. But what keeps you coming back to NCH each and every day?
Well, I love working with my team, as I said. They're always, motivating to sign back on and check in with them, and but also the work is so important to our community, and supporting everyone in the system to do that work is really fulfilling. Obviously we're affecting the actual medical health of our community, but you can't have strong societal health without being actually healthy. So for me, I see it as an ecosystem, and we're just one part of it.
It's a great answer.
Great answer. Very inspirational answer.
Big picture, right?
Well, as we wrap up this podcast, which has been so wonderful, we like to give you 30 seconds at the end to pitch anything that you think is important to your job, to North Country Healthcare, to maybe communities at large. What would you like to use your final seconds to talk about?
I think that just placing an emphasis on creative problem solving, I think, is really important for really every aspect of our community, and healthcare specifically right now. It's a challenging time for healthcare, especially rural healthcare. There's funding shortages not only in the grant level, but at every level. And so one thing I think we do well in the North Country is figure it out and, not let challenges and barriers stop us. So if we can just continue to do that and work together as a team, and to continue to highlight each other's strengths and to rely on each other, then we'll be great. So, that works?
That works, yeah. And more inspiration from Scarlett Moberly. Well, thank you so much, Scarlett, for joining us today. It has been an absolute pleasure, and I'll see you on the next Teams call.
Yes. Thank you. Take care.
Well, Ren, I just want to say, we've had two of your team members on the podcast, and they both are just so cool and so much fun. And I just want to say you are very lucky to have some great team members.
Yeah, all of my team members, right, make me look a lot cooler than I am. So I'm very lucky to have the five of them, but I find Scarlett to just be absolutely brilliant, and very proud that she's on my team.
Yeah, absolutely. And the work alone, I think the title, a lot of people probably see that title and say, yeah, I don't know what that is. So it was really nice to hear Scarlett break that down, because there were pieces even I was like, oh, didn't know that. So again, that's one of my favorite pieces of this podcast, is that we get to learn a little bit about everybody and kind of the intricacies of their role and their day to day. I find it so fascinating.
Yeah. Well, do you think that'll be your next career, is grants and community benefits coordinator?
I keep saying, every other person, I'm like, oh, that sounds so interesting. So who knows?
Who knows? Well, Gavin, Scarlett was a great guest, and we have another great guest coming up next. We've got Dr. Mark Morgan joining us. Dr. Mark Morgan sits on our cabinet. He is our Chief Medical Officer for North Country Healthcare, and he's an anesthesiologist by background. So really looking forward to understanding that journey and how he got here. I know that both he and his wife are North Country natives, and that they really like being in the outdoors. So excited to hear you ask your signature question to Dr. Morgan on how he finds that balance, because I think he's going to have some good tips for us.
Yeah, along with that question, I already have a bunch swirling. So
Awesome.
very much looking forward to that conversation.
Awesome. Well, until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.